evening. I'm Kara Burnett.
And I'm Sayre Williams. Thank you for joining us for this special edition of WMAR-2 News.
Spring is a season of new life, but for many Black women, the journey to motherhood, well, that has its own set of challenges.
From pregnancy to postpartum, Black women face disproportionate risk when it comes to their health or the health of their babies.
It's Black Maternal Health Week, and in this half hour, we're sharing stories of adversity, but also some incredible work that Black mothers are doing in the maternal health space.
We explore questions you should be asking your doctor, the power of a supportive mom village, and what policies and research are shaping the future. Founded in 2018 by the Black Mamas Matter Alliance, Black Maternal Health Week brings awareness and action to uplift Black moms every step of the journey. According to the CDC, Black women are 3 times more likely to die from pregnancy-related causes. While mortality rates have dropped for other racial groups, the number has increased for Black women.
Getting to the root of the Black maternal mortality crisis takes policy change, advocacy, and research. That takes us to our next story of one woman looking to fill the gaps in communication.
I had to advocate for myself a lot, to the point of saying, hey, I'm gonna leave this hospital and find care elsewhere in the middle of labor.
And I know a lot of other mothers not wanting to go to hospitals because they just know how quick that power can be taken from them.
Why are Black women more than 3 times more likely to die from pregnancy-related complications? Why have the numbers gotten worse? What can be done to improve outcomes? Like many researchers in the maternal health space, Towson University professor Tosin Adebayo is trying to answer those questions.
This is not a new issue. This is not a new problem. We've talked about, maternal mortality among the Black race for years, for decades. Every other racial group has a decrease, but Black women.
It was Tosin's own experience giving birth to 3 daughters that led her to start the research.
Reading all these scary things about Black women dying and passing away from pregnancy is like, oh my God, I'm in the demographic. Is this going to happen to me? And that was the beginning of my interest.
Her research boils down to communication, or the lack thereof, how the quality of healthcare is shaped by how patients and providers interact.
What am I hearing? How am I making sense of what my provider is telling me? Do I feel safe enough to talk to my provider?
She says the burden is often placed on Black women to have to advocate for themselves.
Unfortunately, it is a real skill that you have to develop, because sometimes you are not listened to. There are several discourses and perceptions about you that have gone ahead of you in the healthcare system that you're not even aware of.
She adds that the problem is multifaceted: racial discrimination, microaggressions.
We have social determinants of health. We have issues of education, where you live.
There's a long history of mistrust for the medical system, but also just the feeling of not being comfortable.
There's ample research to tell us that African American women are more comfortable, or even Blacks in general, with healthcare providers who are of the same race as them. They understand their history, they understand their perspective.
As part of her research, she would go into prenatal appointments to observe interactions.
I was actually in the delivery room with this woman, and she just wanted me to observe what was happening, and at some point she needed someone to speak up for her.
But Tosin knows she won't always be in those rooms to advocate for other Black women. Still, she hopes her research will help move the needle.
We are not talking to one another. 80% of maternal mortality cases are preventable. There are things that could have been caught early on, but how are we coming together to create a layered approach to solving the problem of Black maternal mortality?
Maryland's making big moves to protect moms. A new law now requires doctors and health departments to report prenatal and postpartum risk, or they could lose Medicaid funding. The goal? Cut down maternal deaths, especially among Black women. Plus, over $5 million in federal support is helping hospitals and universities improve care and do more research. And places like Mercy Medical Center and MD Mom are leading the way, training thousands in tracking most births statewide. When Black mothers need support, Mama Needs a Hand steps in, creating a village where there wasn't one and making sure no mom stands alone. In a world where the pressure of parenting can feel overwhelming, single mom Diamond Jaggers is finding her footing. With 5 children under one roof, the demands of daily life can be daunting. That's where New Momish comes in. A mom village providing relief for moms.
It was a Friday, and I was feeling so burnt out from the week. I saw the ad, and I just clicked on it to learn more information about it.
We got on the phone with her that evening because we have to do a FaceTime call to verify their identity.
Contacted me that very same day to serve me the very next day.
And literally the next day at 12 o'clock, our mom assistant was at her home serving her, helping her with her toddler, her infant, and her other kids.
The notion of a village is a concept deeply rooted in African culture, and today it holds significant power in nurturing families.
All of us just need a little help, and oftentimes we're calling on a village to support us and no one's showing up. It's like after the baby shower, it doesn't even matter that we need extra support.
Not having the support, not having the village like they used to have back in the day. That's what makes it challenging.
Mama Needs a Hand, a program by New Momish, is the village some moms need. It also supports the mental health of the mother.
If you're constantly in mother mode, you're neglecting your own self-development, your own self-growth, your own self-nourishment, and it's going to be detrimental. It's not going to serve your kids well in the long run.
A mom assistant will step in and help, whether it's playing with the kids, cooking dinner, or letting you get some peace and quiet for a couple of hours.
We also bear gifts, so we bring stuff to the moms. We ask them, what do you need in your house? Can we bring laundry detergent? Can we bring dish soap? Can we bring anything to make the house a little bit better than when we came?
Diamond says single Black mothers don't often get the recognition and support they deserve.
When I'm scrolling on social media and I see all the backlash and all the negative feedback that single Black mothers get from society, from within our own culture, it's so depressing.
Founder of New Momish, Gilly Shaw, says support from services like Mama Needs a Hand is essential to empower them and validate their experience.
I think it's important to support the one who's wearing so many hats and doing so much because she will never ask for help. She never asks for it because she thinks she can do it all, or maybe she thinks people just won't show up for her. So at New Momish, we say, you don't have to ask. We're going to come to you.
Diamond says Mama Needs a Hand provides practical support and breaks down the stereotypes that often surrounds Black mothers.
I don't have to bother with what they're saying about me because I have support here.
And for Diamond, it's a relief to know she's got a helping hand.
You don't have to do it all. Give yourself some grace and celebrate yourself.
Over 35% of U.S. counties are maternity care deserts, meaning there's a lack of obstetric care, birthing centers that are limited or just absent. So we created this map highlighting resources that are right in your backyard. This county-by-county guide highlights different community groups, state and local resources that offer support for families. And that includes one group that has been around since 1991, Baltimore Healthy Start. They work to reduce infant and maternal death. So what does that look like? Well, it's a free pantry for parents, nurses that go into homes to check on moms before and after they give birth, doula services, and breastfeeding education classes. Studies show that Black babies are less likely to be breastfed than other racial groups.
Infant mortality rates in some of the areas that we cover were as high as like in the 21 percentile. If it's something that's stopping a mom from being healthy, we try to provide that so that they can be healthy and the babies can make it to their first birthdays.
And all of these resources are free for families. Tarana Hughes has been working with Baltimore Healthy Start for 23 years. They stepped in at a time when she needed someone to lean on.
Being a mom who had a health crisis when I had my son, I suffered from preeclampsia, suffered a seizure. So being a mom is very crucial to have, education, support.
Coming up, how Black doulas are stepping up to close the healthcare gap for pregnant Black women.
Digging deeper into the disparities of Black maternal health, while there's just some numbers that aren't quite adding up. The University of Maryland School of Public Health and Harvard School of Medicine published a study on disparities in maternity care spending. Researchers examined over 87,000 pregnancies. It takes a look at those with private insurance and the costs they face from pregnancy to 6 weeks after delivery. And here's what they found. Black and Hispanic mothers pay significantly more in out-of-pocket expenses than white parents. For prenatal care, Black people paid on average 74% more. Rebecca Gorevich with the University of Maryland College Park is the lead author on the study.
Patients who are Black or Hispanic are more likely to be enrolled in health plans that are less generous, that leave them on the hook for higher out-of-pocket costs. we're concerned it means they may skip out on some services that they might need.
As many as 50% of people are still paying off their medical bills a year after they give birth.
When you add this on top of historical differences in income and in wealth and in debt, I think that's a reason for concern.
They're not just learning birth work, they're learning heart work. Black doula training is raising a generation of advocates guiding Black mothers from first kick to first cry and far beyond. Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related complications than white women.
It's bothersome. Women deserve better. We need to do something.
Black Doula Training Organization is trying to change that statistic. Nikita Johnson, president of Doula Training, says that a doula is an advocate and emotional supporter helping navigate healthcare.
Whether it's through fertility, adoption, loss, grief, a doula is able to be that person to kind of step in.
Doulas are champions for moms in a system that Johnson says can be biased. Johnson created a training program so Black moms could have someone in their corner that looks like them.
They specifically want to support the minority of women who just don't know. They don't know that they have options. They don't know that doulas exist. They don't know that they have rights.
But what does it take to become a doula? It's not just about being there during labor. Doulas undergo 6 months of training in childbirth education, postpartum care, and emotional support techniques.
Given that people have options when it comes to birth, you would want to really be well versed in knowledge and knowing how to support these families.
For many women entering the field, it's about more than just a career. It's a calling. Johnson was an OB surgical tech in labor and delivery for 6 years. Her experience there brought her to this field.
I've seen a lot of things happen. I became traumatized behind a lot of the things I've seen with the doctors forcing inductions that lead to C-sections, not giving moms enough time to get through an induction.
The CDC says Black women in the U.S. are disproportionately affected by pregnancy-related deaths, often due to preventable factors.
But when you bring up an induction with a mom who is a low-risk pregnancy, no complications, everything has been going well, you increase the risk of the body rejecting the induction.
Doulas, especially Black doulas, are working to change that narrative, ensuring that these women are not just seen, but heard, empowered, respected, and safe.
With the maternal mortality rates, we truly need doulas to stay. We need them to be within this field to combat these numbers.
One Baltimore woman started a program to support young mothers, but then she had to put everything on pause when she had to process a loss of her own. 1 million. That's how many pregnancies end in miscarriage every year. But what happens after the loss? What happens in that in-between of mourning and returning to everyday life?
How difficult it is to just adjust to their new norm with being a woman without a baby and wanting a baby so desperately.
Tamira Dunn falls in that in-between. For the past 7 years, she's worked as a maternal interviewer for Fetal Infant Mortality Review under the Baltimore City Health Department.
They become frustrated, also frustrated with the healthcare system and feeling like they didn't get the services or the support that they needed.
She reads testimonies to the board. From there, they develop strategies to improve care and identify any gaps in the system.
We're getting all of the evidence from their medical records, but it's nothing like hearing from the mom's voice. What happened? Now we have RAT cards.
From the feedback, they created these cards with signs and symptoms of preterm labor, so moms at clinics and hospitals know what to pay attention to.
Just be the support that, I wish that I would have had when I was going through that time.
Tamira miscarried at 15 weeks.
I always wanted to be a mom, so to have that ripped from me, it was hard. It was hard.
After the loss, she created Elijah's Hope Foundation, which holds an annual infant loss walk. Their fund also supports grieving women and doctoral students studying reproductive health. Tamira also started an outpatient mental health clinic, helping mothers going through postpartum depression.
We need somebody to listen to us. We're so used to trying to be the strong one.
For over a decade, Tamira has worked closely with mothers, all while hoping to become one herself.
Reagan is 8, Aaliyah is 9, and they are my entire world.
Tamira now has a full house with 2 beautiful girls.
They're the motivation behind me continuing to do the work that I do.
And she keeps memories of Elijah close by.
As a reminder that this is why you do what you do. There's another woman that still needs to talk to you, that still needs to support, and you still need to keep going.
Still ahead, one expecting mom is taking control of her care, the question she's asking, and the message every mom-to-be needs to hear. The relationship between a patient and their provider can really make a huge difference when we're talking about birthing outcomes. So I went to an appointment with a mom-to-be as the doctor filled us in on what questions you should be asking. It's another checkup for mom-to-be Whitney Saunders.
Ms. Saunders? Yes. Hi, you can come on back. Okay.
She's 7 months pregnant, just a few weeks away before she can deliver her baby boy.
I'm extremely excited. I cannot wait for this baby to get here.
This will be her first child, but not her first pregnancy.
This go round, it's like when you go through something bad, the second go round, you know what to look for, you know what questions to ask.
A few years ago, Whitney miscarried with twins. She was 5 months along.
I didn't feel like the necessary work was done in terms of making sure certain tests were ran. It really hit me. I would say I dealt with some postpartum, but for the most part, I mean, it just was one of those things like you just carried twins for X amount of weeks, and now it's like, okay, I did all that work, and yeah, I don't have anything to show for it.
This time around, Whitney says it was important for her to find a person of color as her OBGYN.
A lot of people just feel like they weren't listened to, which seems so basic, and it seems like we're really failing as providers because that's half of our job is listening.
Dr. Ferrier and Whitney have talked through her questions, navigated her biggest concerns.
Preeclampsia, although it usually happens at the end of pregnancy, can start to happen early in some women, particularly women of color. We have to look at our own implicit biases of what makes us document a certain attribute about someone that looks a certain way, that they're aggressive, they're non-compliant, that they are easily agitated. That's going to color someone else's picture when they come back and pick up that chart to interact with that same patient.
And she adds that women aren't always getting the proper care in the weeks after they deliver.
There's been a lot of legislation that's been pushing to cover insurance because a lot of women lose their insurance after 6 weeks. We have a bracelet for patients to wear that says, I delivered, I'm still at risk.
If you're ever feeling anxious or unsure during the pregnancy, she says use this acronym, BRAIN. What are the benefits, risk, and alternatives? Do I trust my intuition? What happens if I say no or not now?
I've always wanted to be in a community where I can take care of people who look like me, and then I chose to practice in a more metropolitan area so that I can be of service.
Thank you for joining us. I'm Sayara Williams.
And I'm Cara Burnett. You can find all of our stories on our Black maternal health coverage on our website.
Have a good night.